Well, happy Aloha Friday. It is April 9th here, 10:30, which means it's time for Spotlight Hawaii. I'm Ryan Kalesuji, joined by Yunji Denise. And Yunji, of course, we spent a lot of time talking about COVID-19 on this programming, and sometimes we do like to talk about other topics. And one of those topics we want to talk about is homelessness and housing, an issue that continues to be something that's plaguing the city and county of Honolulu.
Yeah, this is something, of course, that was very top of mind to a lot of folks before the crisis, and now with the pandemic, something that has really been brought front and center. And so we're joined this morning by Anton Krucky. He is the head of the city's Office of Housing and Homelessness. Thank you so much for being here. Let's start out with the scope of your office, just for our viewers who may not be familiar with what you folks actually do. Tell us a little bit about that.
Thank you, Angie, Ryan. It's great to be with you. Well, housing and homelessness, especially affordable housing, are connected. And so we're looking at the whole spectrum of what are the social services needed and how can we utilize federal programs to help people get into shelters and temporary housing. And then in the end, you need the inventory of affordable housing, or we can't have people in them, plus the other social aspects of affordable housing. So this office has been commissioned to really get an understanding of the inventory of housing that the city has. And so we can look at what kind of acquisitions we want to make, what kind of repairs and upgrades we want to make, and be able to manage that. The execution happens in the departments. And then also we set policy for the directions that we're going to take in addressing the homeless situation. So we'll be doing that. The execution, again, lies in the departments, but the policy setting and really creating new initiatives comes out of this office.
You know, when you think about it, these two issues, if you will, homelessness and housing, these are two major issues that those in the leadership in the city and county of Honolulu have to tackle with. To have everything in this department seems like a pretty big responsibility. So thank you for taking on this responsibility. Let's start off with homelessness. Obviously, we see the growing numbers that continue to live on the streets. And we heard a little bit about the mayor's plans moving forward in this first year of his administration. Can you summarize a little about what the plan of this administration is when tackling homelessness?
So when you say that it seems to be growing on the streets, it actually is. When you look at the sheltered homelessness and unsheltered, we didn't do a point in time count this year because of COVID. But you can estimate it's about 3,000 in each of those categories, right? And one of the things that happened with COVID that is, to your point, is that we have fewer shelter spaces available because of COVID. We've had to spread people out. And so it actually equates into about a 30% reduction in shelter beds that we have. And that equates to about 400 individuals just in that realm. So we've had 400 that were in shelters that now are in the street, right? In addition to the other things that are happening. Now, in terms of our programs, one of the things that we're trying to do is we're trying to look at the point of contact. So the city has a responsibility for emergency response, right? And that's your 911 call. And at the same time, outreach people are going around on sort of a scheduled basis, visiting people, offering shelters, offering them services, trying to work with them. I think an important point is that you can't make them do something. The person has to have a choice. And so our strategies understand that, and we're trying to incorporate them in our strategies. So in the emergency response, what we want to do is we want to develop a program. We've kind of labeled it and branded it CORE, for Crisis Outreach, Response, and Engagement. And CORE will be a set of social services and medical services that will be dispatched that normally HPD would be dispatched to. And so when it looks like a situation, a homeless person or a situation like that this group can dispatch, then they will. And then it'll be a blended strategy because we'll also have situations where HPD will be the backup, right? And then you have other situations that are traditional crime calls, 911 calls, and HPD would be dispatched. In other cities that have done this, you get like about a 30% reduction in these calls that get put with the service providers. So it can be a load and a shifting from HPD. But I think the significant thing that we're doing in this is different than I think has been done before. Is I just described the program in general to you, but we're going on an 8-week period where we're going to really analyze this program, put it together, and thoughtfully, before we deploy it, thoughtfully understand all the pieces we have. When I say thoughtfully, at this table will be city departments. We have 2 representatives from the state. That's really, when we talk about collaboration, I don't think there's been another time where the state has sat at the table to help design a city program. And so that's really a big deal. We'll have community members, we'll have the providers, which are the outreach people, and we'll also have 2 individuals that have experienced homelessness to also give us advice and counsel. So it's the process may even be more important as we embark on these new strategies that may be really significant. And then we'll also be looking at sanitation. What can we do where people have built up a lot of belongings, whether it be in the parks or the sidewalks or wherever they're at, and what are good ways to try to address that?
The previous administration, their strategy for addressing just that issue was this idea of compassionate disruption, basically sending HPD and other law enforcement agencies to basically go and clear out, seize possessions, store them, and clear out those areas. The mayor has said that that's not something that he necessarily supports. So is that at all part of this new core force? Because how will you address those encampments that we see pop up all over town?
Well, I believe that the solutions to that lie in the communities. So rather than the city doing something to a community, we would like to be working with the community. So I want to learn, I want to understand, I want to embrace what they can do, and then we want to support it. And so I want to work with each community on how we can do that. There has been some success where if you understand that homelessness is not a crime, right? And that these are individuals and we have to treat them with a certain amount of dignity that anyone deserves. And so in that process, if we can understand the communities within those encampments and work with them, then maybe we can make a difference. I could see a time when they're part of the cleanup, right? They're part of the community and the city and the people that are living there are part of the cleanup. And I think if we can do that, I think we make a major shift in what we can do. And within those relationships, then we can build some trust, get them into programs, help them, and in the end, really, address their lives in ways, and them being the biggest part of that, in ways that really are healing and let them have the kind of life that they can express themselves.
Well, from a practical standpoint, what does this core team look like? I mean, is this a combination of social workers? Is this employees of the city and county of Honolulu? And how would they? You mentioned they would be dispersed to deal with situations as a call came in. Where would this team come from? Would it be coming from your office?
I don't believe it'll be run from my office because we're more of a policy office, although we'll go and get the funding for the program. But I don't know where it'll sit yet, because if I did, then I'd be driving this think process, too distinctly. But in terms of your question on who would be in it, yes, social workers and medical, right? Whether it be psychiatric medical or physical medical, will be part of the study of what we can do. I see it as city workers because this is really a 24/7 response, emergency response. So I see that as city workers, whether we contract them to be in the city or city employees.
It's interesting. How have they done this in other cities? Because I imagine that, maybe someone calls 911 and then instead of dispatching to an officer, this then gets patched to, what sort of Ryan was referring to, this idea of this force. I am interested in the actual logistics of this and how other communities that you've looked at have been able to do this.
Yeah, I think the two choices in the communities that I've looked at is a diversion from 911, so people still have that number and 911 diverts it, or we set up an additional number that can be called that will come directly to this group, and they can ask a couple questions and decide if this is their type of response. I mean, we have other responses that are in the state now. Department of Health, they have an outreach for mentally ill potential situations, and so that's part of why I want the state at the table, because we want to coordinate our efforts. We don't want to be duplicating what we're doing, and we want to be very good at what we're doing and enable the other ones. I think also when every time I talk to somebody, they go, Anton, have you looked at this program? Have you looked at this program? And they're successful in their little pieces, and everybody you ask have all these successes, and I keep wondering, why don't they add up? I mean, if you have all these successes, they just don't add up. And so, we need to also, this group will spend a little bit of time looking at, can we coordinate our outreach and provider services a little bit better and get some better coordination in that area as well.
Do you think there might be any confusion? You mentioned the collaboration that will need to happen with the state, but when you look at, the way in which some of these measures will be handled moving forward, it could be different. For example, earlier this week, we saw disruption of the DLIR that went in and, DLNR went into the homeless encampment along Diamond Head to clear that out and to clear those people and those individuals out of that area. Obviously, it's a state land, it's state property, so they have their ways of dealing with that. Do you see any sort of conflict with that, knowing that the state is going to be doing and taking care of their property a certain way, and the city might be handling things different? How do you find ways to collaborate to make sure that there isn't this confusion in how the policy moves forward?
Well, I think collaboration really takes getting together physically, and whether it be this way or electronically, and talking through those particular issues. So I went with the state for their efforts last week, and went through the process that they did. And this morning I was out, and yesterday morning with the city, because above on that road in Diamond Head that you talked about, above the road is state, and below the road is Park and Recs, right, for the city. And so I went and saw how we did both of those. And the process you do is you go through the encampments that they're doing today, and they give a notice to the people telling them what's going to happen, so that the people aren't surprised by the activity. And then they see if they need assistance in moving out, and so they do a lot of the moving out on their own, knowing that we want to clean up an area. And then you have the park closure. It's the same thing, and it could take a couple days to go in and clean up that area. And in our case, we store the materials, and whatever we pick up, we store for 45 days, and someone can come back and get them. I will say that when I was down there, that the state reported that above the road, they didn't have any encampments current and active since last week's action. And below the road, we've had a reduced amount, but now they're just starting that process. But the compassion disruption doesn't work. I mean, you go in and you say, people are there. It creates an environment where we're trying to help people, but it's us against them. You have an individual who they take one step a minute, so that they're not, violating a sit-lie law, or they move across the street, and as soon as they move back, and they know the rules. They know it gets posted, and people send them notices that this is happening. And so not only it pits us against them, right? It also doesn't work. So why should we continue to do something that doesn't work?
Let's talk about the next step, which is sort of the housing piece of this that you made reference to. So, these crews come in, this core team comes in once this is all formulated, and they're able to assess that this person needs help. The next step, of course, is getting them into a shelter, getting them into housing. What's the city looking at when it comes to creating some creative housing options? I mean, we've heard a lot about tiny homes, about container homes, there's different mobile homes, there's different options that are out there. Is the city looking at anything like that to try to get these folks a place to actually go once you've actually assessed that they need your help?
Yeah. So we're hoping to get space back in shelters when COVID starts to die down. At the same time, we're actively looking at how we can build more shelters. I would like to increase the amount of shelters by at least 100 beds during this time. But when you talked about the container homes and the tiny homes, I think more significant than building those, they are very effective. It's this village concept that they create, right? And a village concept is significant because what people need as they're reestablishing themselves is a sense of belonging to something. And if they've lost and severed their ties with their family or whatever their group was, many times these village concepts create a sense of family and a community within them. And then within that, you build trust relationships and you can work on things. So I think that those things have a great play. And when I talked about an individual has a decision whether or not they leave the street or not, so we have to, at that 3,000 people that are on the street, we have to nick away at it with different strategies from all places. And so, the core team is one strategy, but I think the village is another strategy where if we can do that really well, we can draw people to it. It would be something that they would want to come to. And I have some ideas. I don't want to put some of the people on the spot that are doing some very good thinking with me, but I have some ideas that, when we get together and talk again, hopefully we'll be announcing some things that over the next couple of years that I think we could take great pride in. And I think that that's important because we need to find different ways that we can draw people so they're making their decisions into a place where we can help them or they can help themselves, just a better place.
We know that there are different levels of people who are needing support and help, and not all the time are they coming from the streets and looking in for housing. The other side is also prevention and helping people live in a unit where they don't end up homeless. If you can speak to how the city is looking to provide some of these affordable rentals or affordable housing for those individuals who are able to stay with their family, to be able to work a job and be able to afford the resources that are necessary for them to have a roof over their head and prevent them from ending up on the street.
Well, Ryan, I think that's a great question because if you're working on this 3,000 number I'm talking about, if people are coming into that number at the same time you're trying to help people out of it, that's difficult. The part about it is those people want to stay in housing, and so we should be working with them as best we can. And so we have one bill in front of the city council now. It's called Bill 1, where we're actually trying to motivate people in these walk-up type of buildings to renovate them, and we would offer them a grant if they were to do that for affordable housing. And the grant varies based on what they call the average medium income in that area, medium income in that area. So at 65% and 100%. And so we would give a grant. So that's one start, if you will. And that grant would have enough money in it to, maybe make 1,000 more units available for affordable housing. I think we're looking at other ways to do that. We recently put Dawn Apuna, that's in Department of Planning and Permitting, and she's a deputy director, and she's been labeled as our affordable housing advocate. And so what we have there is someone who's looking at all the permitting processes that are for affordable housing and moves them along, or is working with the developers to see what points they need and can we still permit within that and motivate them to build affordable housing. We got, after 9 years, we got the senior living space in Chinatown approved, and that'll be a large number of affordable housing for seniors that'll last 60 years. So we're very excited about that. That's called Halevaulu. And so we already have some things started, but we're going to be very aggressive about loan mechanisms, community block grants that can finance affordable housings, and we're going to target some areas that really can make a difference. So we're going to be very aggressive on trying to create as much affordable housing as we possibly can.
Are you concerned with the moratorium on evictions? With COVID, we've had a moratorium on evictions that I believe is extended through June. But after that, what are your concerns about people who might be, what Ryan was talking about, at risk of losing their homes because of COVID? They've lost income and they perhaps have not been paying their rent.
Well, I think we all should be concerned about that. Not really, it's just a city function. We probably all are connected with somebody that may be in that situation. We just announced the rent relief and utility funding that we're doing, and that has about 120 plus million in it to get out. And we've worked very hard to learn from where some of the CARES Act money didn't get out. And Amy Osselby is running that program, and she's incredibly talented, and she learns every step that she goes. So she's learned from the past, and one of the things she put in place with not just the not-for-profit providers that are helping us, but she's hooked herself up with the private community, who's been very generous to help people make sure they can get into that program. It may be language barriers, or they have internet capability barriers and all of that. But I think she did such a good job, and the announcement did so well, that when we opened it up this Monday, the applications flooded us. And so, they're going to have to play catch up because the processing is doing that. But she knows her goals for each month to get the money out. But I think the flooding just speaks to the pent up need and some of the fear of those impending dates that are coming. And we've got to get as much of this money out as we can. And she's dedicated, and the mayor's dedicated to doing that.
We know that the mayor has also spoken about trying to find ways to involve nonprofits as well as church organizations in this process of affordable housing, of course, and helping with the homelessness issue. If you can expand a little more about what their role and how you believe that that partnership could benefit the city.
Well, the foundations and other nonprofits, I think, can be extremely helpful, and they have been. And one example is I've got a grant from the Hawaii Community Foundation to hire a person to work in my office on homelessness and creating data and helping move our projects. So that's just one example. Um, the faith-based community is an incredible resource that we have. And I think that the fear of state and church has kept us from leveraging that opportunity. And so what we're doing right now, and I did this again by sitting down with church-based organizations and also faith-based organizations, and also with our providers to get their input on how I could build a really appropriate template that then I could engage those organizations. So if they came and they said, we want to do this program, I can have a template that says, here's what we need to do. Here's what we'll provide as a city to engage you. But we need, an example would be, we still need to have our provider people engaged, so that an individual they may be helping isn't disengaged from the provider network and all the things they can do. And we can provide training in this area that can help them. Right. And if the template is good enough, what that does is then when someone else comes to me and says, we want to participate, I can help them participate, saying, yes, here's how you go about doing it. So it isn't like I'm doing one and not doing another. So I'm trying to keep that piece kind of egalitarian, but I want to engage those groups. And I believe that again, if our solutions are going to come from our communities, we have to understand our communities are not just geographic. They're defined in many ways. And I think we need to leverage all of those, again, learn, understand, embrace, and support. And so that's what I want to do. So we're moving in that direction. And I think we can, and we stay away from our articulating ministry. Let them. It really will be based on fulfilling a mission. And I think that will be able to get through on that. I still have some things to do, but I expect to be getting that out. I have the follow-up meeting with a group that initially approached me, and I plan on presenting that, let them give me the feedback, and then after that we'll probably kind of memorialize it.
This is an issue that the previous administration and administrations before them, worked very hard to tackle and were not successful. What do you think is different about the strategy that you're taking? Not to necessarily criticize what was done in the past, but what was missing from that approach, and what new ideas are you bringing?
Well, maybe I don't know what I don't know. I mean, I've not been in government before, right? I've always been in business, and the mayor asked me to come in and do this. So I'm looking at it with how you develop solutions to things, right? Whether you're developing products or people solutions or whatever you're doing, and that's how I design them. Now, if there's certain pitfalls, like I talked about church and state, and then I have to go through those pieces, because in any product design, you have issues and you sort those issues out. So to say what's different, I just think, a combination of that, we're approaching it with a business attitude, and it's because that's the only way I know how to approach it. But I also know that in the end, in business, the customer are the people that decide what you do. And in our case, the community and how we can help the community will be the decision makers. But again, maybe I don't know what I don't know.
Early on in the pandemic, we saw individuals flying into Hawaii. Many of them were homeless and coming to Hawaii and living on the beaches. And because of the program that was established, that they were actually flying people right back to where they came from, and the city, or the state, I should say, paid for that individual to fly back home. And so there has been talk about continuing on in that sort of idea of helping people return back home from where they came. Do you think that that should be a part of the city's strategy moving forward?
Well, the concept of travel isn't, a person has a right to travel. I mean, COVID's put other rules on it that weren't there before, but a person has that right. And I think that, I've heard those stories too. I don't know the documentation. I've talked to the state about it. And the response really it was a thoughtful one. They said, we have heard of some of those situations. that people have been funded to come here, and we try to address that. But they felt that many times a person came and became homeless because things fell through. They either had friends that they thought they were going to come to, or they had a job they were going to come to, and those things fell out. The state told me that they thought it was a small percentage of people that were in the situation you talked about. Although, on the street, I've had a lot of people talk to me about it, but I haven't. That was their response when I investigated. I don't see the city getting involved in that. I think the Department of Transportation and the airports and those folks. So I kind of see that as a state function and responsibility.
We're running out of time here, but I do want to get back to the ideas that you brought us at the top of the broadcast, this core force that you were talking about, mental health workers and social workers and people who might be able to address individuals in need in a different way than what has traditionally been done. What's your time frame for when something like that could actually be stood up? I know you said that you're meeting with policy and stakeholders now. So when can we actually expect to see something like that announced and actually, when does the rubber meet the road, if you will?
I expect this summer. I expect you'll see branded vehicles out and working. We have a logistics thing. The vehicle part isn't hard, but hiring the personnel and getting some of those logistics. But I don't know why we can't do that. That's what the city does. And if we can find the right individuals and pay them appropriately, again, I expect the relief money to fund it the first year. So I'm very excited about it. I think that's when we can expect to see it. But within all these solutions that we do, I think one of the themes, if you will, is very important. Is that not just the understanding the homelessness is not a crime, and that we can't just do something to them because that's inappropriate, both legally and also about the person. But I think in the end, when we look at what we want to do to address this problem, I think we need to do things that we're proud of, that the community can take pride in, and I think that's an important point, because if you don't have that umbrella that really is driving what you do, then you're on a wrong thing. It's not about counting numbers. It's not about it's really let's do some good things. Let's really make a difference, but let's be proud of what we do. And I think in Hawaii that's foremost.
All right. Well, Anton Krucky, Executive Director of the Office of Housing and Homelessness, thank you so much for taking time out of your Friday morning to join us here and to speak a little more about this issue.
Mahalo.
Thank you.
Thank you. And we definitely want to have him back in the summer when we start to see what he's talking about, branded vehicles. If anyone missed the top of the broadcast, the director there laying out his vision that is still in the works right now, but basically creating a separate task force, if you will, that, instead of calling 911 when a homeless individual is out on the street, or if you notice that someone needs help, you could actually call this group and that they would come out and respond appropriately. They've done it in other cities, and I think that we are looking for new solutions. And Ryan, the idea that we could have this up and running by the summer is pretty encouraging.
Yeah, it's a different shift in what we've seen in the past with the compassionate disruption of the prior administrations and the homeless sweeps that have become somewhat common here in the city and county of Honolulu. And this is really a new way and a new mentality and approach to this issue. And there will be a lot of things that have to be discussed. He spoke about bringing people to the table, which will include the state as well, to inform them and to collaborate together. There will be those from the medical community as well. And really, it will be about trying to develop what this new core team will look like and how they will implement that. It'll be interesting to see how tactically and how specific, and when this actually happens and unfolds, what this will look like. So very interested to see how that all pans out.
Yeah, and then he also talked about some of the challenges with COVID, just having to physically space people out more, that they've lost around 30% of their shelter beds right now. And so that is having an impact, just the numbers of people that are now forced to be out on the street because those shelter beds are not available. So his idea of wanting to build at least, the infrastructure for 100 more shelter beds, and then talking about other ideas, the ideas of tiny homes, but he referenced more of the village concept, basically incentivizing people to want to get into housing, rather than, the situation where you're kind of trying to force people to do things that they don't want to do.
Yeah, there is just so much to this issue. Obviously there is no magic wand or easy answers, and it will be a process that will also include affordable housing, as he mentioned. And there is obviously some concern when that rent and mortgage, order that
Eviction moratorium, yeah.
eviction moratorium could expire, and there is obviously concern about that. And so this is a large issue, and we will continue to stay on top of it and bring those leaders in who are making those decisions about just this. Someone else that works directly with homelessness on this issue is the Lieutenant Governor. Of course, he has been solely focused, it seems like, on COVID-19, but he is also someone that has been working hard on this homelessness issue as well. We'll actually be speaking to him on Monday.
That's right. He's always a popular guest. Of course, he's in charge of safe travels, the vaccine rollout, and he does have a hand in the state's response to homelessness. So we'll be talking to him about this on Monday, as well as all the other things he's in charge of. We know a lot of you have questions about vaccine eligibility and also safe travels and the idea of vaccine verification or a vaccine passport. So we'll be asking him about that on Monday. Then on Wednesday, Ryan, we're going to be talking about a bill moving through the legislature, this idea of legalizing marijuana.
Yeah, we're going to be hearing from both sides on that issue. One of the authors who is advocating for this, Senator Chris Lee, will be speaking. And we'll also be speaking to those on the other side who believe that this is not the time for Hawaii to be moving in that direction and following suit with what other states are doing to legalize marijuana here in the state of Hawaii. It should be an interesting conversation.
Yes, and then a week from Friday, or a week from today, rather, we have the director of the Department of Labor and Industrial Relations. So if you have any unemployment issues, we want to hear from you. So do make sure to join us a week from today to hear from her. But have a great weekend. Stay safe. Wear a mask. If you're eligible for a vaccine, please do sign up to get one. And we'll see you right back here at 10:30 on Monday.
Have a great weekend.